Trauma management is a critical area in mental health, and this episode complements the Trauma Management Training course by Therapy Trainings. Whether you're an experienced professional or new to the field, we'll provide valuable insights into understanding trauma, its impacts, and effective strategies for addressing it in your practice. In this episode, we'll explore the physiological, psychological, and behavioral manifestations of trauma. We'll also look at the different classifications of trauma and how it influences cognitive, emotional, and social functioning. You'll learn about evidence-based assessment tools and therapeutic interventions, and we'll discuss the importance of cultivating a trauma-informed approach in our therapeutic settings. Additionally, we'll cover the crucial aspects of secondary trauma and self-care techniques that every therapist should be aware of. So grab a cup of tea, settle in, and let's get started. Let's first unpack the concept of trauma itself. Trauma can be likened to an emotional wound, one that can leave lasting effects on an individual's mental and physical health. But what does trauma really look like? Trauma manifests in various physiological, psychological, and behavioral ways. You might notice a client exhibiting signs of anxiety, like sweating, trembling, or a racing heart, when discussing past experiences. These are physiological responses triggered by trauma. Psychologically, trauma can lead to symptoms of depression, anxiety disorders, post-traumatic stress disorder, and more. These conditions can shape how a person perceives the world, themselves, and their relationships with others. Behavioral manifestations can include withdrawal from social situations, increased irritability, or even substance abuse as a coping mechanism. Have you ever wondered how we classify trauma? There are several classifications we need to consider. We often hear about acute trauma, which results from a single distressing event, such as an accident or natural disaster. Then there's chronic trauma, which stems from repeated exposure to distressing experiences like ongoing abuse or neglect. And let's not forget complex trauma, which is often the result of multiple traumatic events, particularly in childhood. Understanding these classifications is vital in tailoring our interventions and support for those affected. Now, let's talk about the impacts of trauma on cognitive, emotional, and social functioning. A common misconception is that trauma only affects emotional responses. However, trauma can severely impact cognitive processes as well. For instance, individuals may experience difficulties with memory or concentration. They might also struggle with decision-making or exhibit cognitive distortions such as negative self-talk. Emotionally, trauma can lead to a roller coaster of feelings. Individuals may feel trapped in a cycle of shame, guilt, or fear, often leading to heightened emotional responses in situations that may not warrant such intensity. This can affect their relationships, leading to social withdrawal or conflict. The therapeutic process for trauma victims is critical, and this course emphasizes evidence-based assessment tools and therapeutic interventions. You might wonder, what are these tools and how can they help? One common assessment tool is the Trauma History Questionnaire, which helps gather information about an individual's trauma background. Another is the PTSD checklist for DSM-5, which assists in assessing the severity of PTSD symptoms. When it comes to therapeutic interventions, we have a plethora of options. Cognitive behavioral therapy, or CBT, has been shown to be particularly effective in treating trauma-related symptoms. It focuses on changing negative thought patterns and behaviors associated with trauma. Eye movement desensitization and reprocessing, or EMDR, is another powerful technique that can help clients process distressing memories in a safe environment. OnMent. Cultivating a trauma-informed approach is essential in our work. This means creating an environment where clients feel safe, respected, and empowered. It involves understanding the prevalence of trauma and its effects on individuals. As professionals, we need to be aware of our own biases and how they might affect our practice. This approach fosters resilience and can significantly improve outcomes for clients. Now let's shift gears and talk about a crucial topic: secondary trauma, also known as vicarious trauma. This is a phenomenon that often goes unnoticed and can profoundly affect mental health professionals. Have you ever felt emotionally drained after a particularly intense session with a client? That's a sign of secondary trauma at work. It's essential to recognize that our work can take an emotional toll, leading to burnout, compassion fatigue, and even diminished effectiveness in our roles. So, how do we combat secondary trauma? Self care is paramount. It's not just a buzzword, it's a necessity. Engaging in activities that replenish our energy, such as exercise, mindfulness practices, or even spending time with loved ones, can make a significant difference. Professional development and supervision are also crucial. Regularly discussing cases with colleagues or supervisors can help process our feelings and experiences, providing much needed support. Now, let's briefly touch on some common misconceptions regarding trauma and its management. One prevalent myth is that trauma only affects certain people, or that it's a sign of weakness. In reality, trauma can impact anyone, regardless of their background or resilience. It's vital to approach this subject with empathy and understanding, recognizing that everyone has their own unique response to traumatic events. Another misconception is that trauma can be easily fixed. Healing from trauma is a journey, not a destination. It takes time, patience, and often requires professional assistance. As mental health professionals, it's our responsibility to guide clients through this journey, providing the support and resources they need. Before we conclude, let's reflect on the significance of this knowledge. By understanding the multifaceted nature of trauma and its effects, we can enhance our therapeutic practices and better serve our clients. The insights gained from the Trauma Management Training course by Therapy Trainings equip us to recognize trauma's signs and symptoms, apply effective interventions, and foster a trauma-informed environment. As you continue your journey in the mental health field, remember that the work we do is incredibly impactful. Every session, every conversation, every moment of support can bring about significant change in someone's life. As we wrap up, I encourage you to take what you've learned today and apply it to your practice. Consider how you can cultivate a trauma-informed approach in your therapeutic settings. Reflect on your self-care practices and how they can help mitigate the effects of secondary trauma. If you're looking to deepen your understanding of trauma management or explore other enriching topics, I highly recommend visiting Therapy Trainings at therapytrainings.com. They offer an array of courses designed to enhance your skills and knowledge in mental health care. Thank you for joining me today as we explored the critical aspects of trauma management. I hope this episode has provided you with valuable insights that you can carry into your work. Remember, healing is possible, and as mental health professionals, we have the tools to facilitate that journey. Until next time, take care of yourselves and your clients.